Every year, over 500,000 American families declare bankruptcy, not because they lost their jobs, not because they gambled away their savings, not because they made terrible decisions, because they got sick. In the richest nation on earth, a hospital visit can erase everything you have worked a lifetime to build. And the people profiting from your suffering are laughing all the way to the bank. This is not about politics. It is about math. It is about a system deliberately designed to extract maximum dollars from sick people. And today, we are going to expose exactly who is getting rich, while your retirement vanishes into medical bills you never saw coming. By the end of this breakdown, you will understand why your health insurance premium keeps climbing every single year without fail. You will see the hidden middlemen skimming billions off your prescriptions every time you fill a bottle. And you will know exactly why the system stays broken no matter who sits in the White House or which party controls Congress. The numbers are staggering. In 2023, Americans spent $4.9 trillion on healthcare. That is not a typo. Trillion with a T. The federal government spends less on national defense than we collectively spend trying to stay alive. The entire military budget looks small compared to what flows through hospitals, insurance companies, and pharmacy counters. To put that in perspective, that works out to roughly $14,570 per person. Every man, woman, and child in America, including newborns and people who never saw a doctor all year. That is more than double what people spend in other wealthy countries. Germans pay about half what we do and live longer. Canadians pay about 60% and have better health outcomes. The British pay even less. Yet Americans die younger, get sicker more often, and carry more medical debt than citizens of any comparable nation. By 2033, health spending is projected to hit $8.6 trillion. That is not a distant future most of us will never see. That is your 50s, if you are in your 40s now. That is your retirement years if you are planning one. That is the world your children will inherit. And here is the part that should make you furious. These costs are growing faster than the economy itself. Healthcare spending increases at 5.8% annually on average. The economy grows at 4.3%. That gap might sound small, but compound it over decades, and it is devastating. That gap means healthcare takes a bigger slice of everything we produce every single year without exception. It means your wages get eaten alive by insurance premiums before you ever see your paycheck. It means your employer can afford fewer raises because their benefits costs keep climbing. Right now, healthcare accounts for 17.6% of everything America produces. By 2033, it will be over 20%. Think about that. 1 in every $5 flowing through the entire American economy will funnel into the healthcare machine. Not education, not housing, not food, healthcare. That is not sustainable. That is a ticking bomb strapped to the American dream. But here is what the industry absolutely does not want you to understand. The money does not go where you think it does. Doctors are not getting rich off this system. Most physicians are drowning in student debt and administrative paperwork. Nurses are burnt out, underpaid, and leaving the profession in record numbers. Hospitals in rural areas are closing left and right. 117 hospitals shut down between 2019 and 2023 alone. Small towns across America lost their only emergency rooms. So where does the money actually go? Follow the trail of dollars, and you find 3 groups of people gorging themselves while patients suffer and die. Insurance executives building empires on denied claims, pharmacy middlemen skimming billions through hidden markups, and hospital administrators playing games with fictional prices nobody actually pays except the unlucky. Let us start with the insurance companies, because what they have built is breathtaking in its efficiency at extracting wealth from sick people. The 7 largest publicly traded health insurers in America made $71.3 billion in profit last year. Not revenue, not gross income, profit, pure money left over. After they paid all their employees, covered all their expenses, and handled all their claims. $71 billion extracted from a system full of people who had no other choice but to participate. UnitedHealth Group alone pulled in $23 billion in profit in 1 year. That is more than the entire gross domestic product of Iceland. More than many countries produce in a year. One company, 1 year. And what exactly did they do to earn this astronomical sum? They denied roughly 1 in 3 claims from their own policyholders. You pay your premiums every month like clockwork. You do everything right. You get sick. And 1/3 of the time, they tell you no. Coverage denied. Figure it out yourself. The insurance industry likes to claim thin margins. They point to their 3 to 5% profit margins and pretend they are barely scraping by. Poor us, they say. We hardly make anything. But those margins are calculated on revenues that have absolutely exploded over the past 15 years. Since the Affordable Care Act passed in 2010, the top 5 health insurers boosted their annual profits by 230%. They took a law that was meant to expand coverage to uninsured Americans and turned it into a profit extraction machine. Now look at who actually runs these companies and how they are rewarded. The CEOs of the 6 major national health plans earned a collective $159.4 million in total compensation last year. $159 million for 6 people. That is enough to pay the annual premiums for over 17,000 families with employer-sponsored coverage. 17,000 families could have their entire healthcare costs covered for 1 year with what 6 executives took home. The former CEO of UnitedHealth made $26.3 million in 1 year. That is 348 times what the median employee at his own company earns. Let that ratio sink in. 348 times. If the median employee works 40 years at UnitedHealth, they will not earn in their entire career what this man made in 12 months. The CEO of Elevance Health made $20.5 million. That is 370 times her median employee's salary. The CEO of Cigna made $23.2 million, 279 times his workers. Every single major insurance company pays their top executive hundreds of times what their typical employee makes. Every time your premium goes up, remember those numbers. Every time your deductible forces you to skip a necessary prescription, think about $26 million for one person's annual paycheck. Every time you choose between paying the light bill and paying your medical bill, remember who is prospering from your impossible choice. And the profits keep climbing year after year. The industry added more than $500 million in new profits between 2023 and 2024 alone. $500 million in 1 year of profit growth. While families across America ration their insulin, while cancer patients set up GoFundMe pages to afford chemotherapy, while 3 million Americans now owe more than $10,000 each in medical debt they cannot pay. What state do you live in? Drop it in the comments below, because these insurance giants operate nationwide. But the pain hits differently depending on your zip code. Some states have more regulations. Some have less competition. Your location determines which company denies your claims. Now here is where the system gets truly sinister. The insurance companies do not just deny claims at random. They have not hired armies of doctors to carefully review each case. They have built sophisticated automated machines to reject your care instantly without any meaningful review. And they are getting better at it every year. Nearly 15% of all claims submitted to private insurers are initially denied. That includes claims for services that were already pre-approved through the prior authorization process. You call the insurance company. You wait on hold. You get transferred 3 times. You finally get permission for your procedure. You have it done. Then they deny it anyway. The pre-approval apparently meant nothing. In 2023, roughly 49 million claims were denied across plans sold on the healthcare marketplace. 49 million times. Someone with insurance was told their care would not be covered. That is 49 million phone calls, 49 million letters, 49 million moments of panic. Hospitals and health systems spent an estimated $19.7 billion in 2022 just fighting these denials. Not providing care, not buying equipment, not paying nurses. $19 billion went to paperwork battles with insurance company bureaucrats. Imagine what that money could have done if it went to actual health care, instead of arguing over who pays. And here is the kicker that should enrage you. More than half of denied claims get overturned when providers actually appeal. Over 50%. That means the insurance companies knew they should have paid from the beginning. They denied the claim anyway, betting you would give up. Betting you would pay out of pocket rather than fight. Betting you would just accept the rejection letter and move on with your life. More than half the time, they were wrong. But they still came out ahead because most people never appeal. This is not insurance in any meaningful sense. This is a bet that sick people will not have the energy to fight back. And usually, that bet pays off. The situation is getting worse, not better. Claim denials increased 16% between 2018 and 2024. The initial denial rate climbed to nearly 12% in 2024 alone. And now, insurers are deploying artificial intelligence to reject claims at industrial scale, with no human review whatsoever. One lawsuit alleged that major insurers used AI systems to bulk process claim denials so fast, they rejected over 300,000 claims in under 2 months. When patients actually appealed these AI-generated rejections, 90% were reversed. The artificial intelligence was wrong almost every single time, but most people never file an appeal. They just pay the bill or go without the care. The AI denial strategy works because it exploits exhaustion. If this breakdown is helping you understand what is really happening in American healthcare, hit that subscribe button right now. It is free and ensures you will never miss the next investigation. But insurance companies are only one head of this hydra. The second might actually be even worse, because almost nobody outside the industry knows they even exist. They are called pharmacy benefit managers, PBMs for short, and they may be the most profitable middlemen in American economic history. Here is how the scam works in practice. When your doctor writes you a prescription for medication, you do not simply walk to the pharmacy and pay a straightforward price based on what the drug costs to make. That would be far too simple. Instead, between you and that pill sits an elaborate maze of intermediaries, each one taking their cut before the medication reaches your hands. The 3 largest PBMs now manage nearly 80% of all prescriptions filled in the United States. That is 275 million Americans, whose medications flow through exactly 3 companies. 3 companies controlling 80% of all prescriptions. That level of concentration should terrify anyone who believes in competitive markets. Those 3 companies are CVS Caremark, Express Scripts, which is owned by Cigna, and OptumRx, which is owned by UnitedHealth Group. Notice anything familiar about those names? The same insurance conglomerates that deny your medical claims also control which drugs you can access and how much you have to pay for them. They control the whole pipeline from start to finish. The Federal Trade Commission launched an investigation into these companies. What they found was stunning, even by the standards of American corporate greed. The big 3 PBMs marked up numerous specialty generic drugs by hundreds of percent, some by thousands of percent. Not slight price increases, not reasonable margins. Thousands of percent markup on medications people need to survive. One cancer drug called capecitabine, a generic medication used to treat breast and colorectal cancer, was marked up 3,289%. That is not 33%. That is over 3,000% for a generic, for a cancer drug, for people fighting for their lives. These astronomical markups generated more than $7.3 billion in excess revenue between 2017 and 2022. Billion with a B, on drugs that should have been cheap generics available at reasonable prices. $7.3 billion skimmed by middlemen who added nothing to the actual care of patients. The FTC found that PBM-affiliated pharmacies did not just charge more for these medications. They also disproportionately dispensed the most profitable prescriptions through their own pharmacies. When there was serious money to be made, they steered prescriptions to pharmacies they own. When a drug was less profitable, it got sent elsewhere. They rigged the system to capture maximum profit. Almost 30% of Americans now report rationing or skipping doses of their prescribed medicines because they cannot afford them. 3 in 10 people gambling with their health outcomes because the system prices them out of medications they need. And the PBMs have a perverse incentive structure baked directly into their business model. Their profits often come from rebates that are calculated as a percentage of a drug's list price. The higher the list price goes, the bigger their rebate becomes. So they actively prefer expensive drugs over cheaper alternatives. They build formularies that favor medications with high sticker prices, because those generate larger kickbacks for the PBM. This creates an unstoppable doom loop. Drug companies raise prices so they can offer bigger rebates to the PBMs. PBMs pocket those rebates, and then demand even larger ones next year. Prices climb higher and higher. Patients pay more and more, and the middlemen get richer while adding zero value to the care equation. Meanwhile, the local independent pharmacy, where your grandmother filled her prescriptions for 40 years, closes its doors forever. Small pharmacies cannot survive when PBMs reimburse them below their actual cost, while paying their own affiliated pharmacies premium rates for the same drugs. The FTC found that PBMs reimburse their own pharmacies at higher rates than they paid unaffiliated pharmacies on nearly every specialty generic drug they examined. This is not market competition. This is systematic consolidation designed to eliminate alternatives until patients have no choice at all. Stick around, because we have not even gotten to hospitals yet. And what they charge might be the biggest legal scam operating in America today. Most people have no idea how exposed they really are to hospital pricing games. But the next part of this story might hit closer to home than anything else. Every hospital in America maintains something called a charge master. Think of it as a master price list for every single procedure, test, supply, bandage, and aspirin the hospital provides. And these prices have almost no relationship to economic reality. They exist in a parallel universe, where aspirin costs $30 and a bag of saline solution costs $700. Multiple studies have documented the insanity. Chargemaster prices average 2.5 times what insurance companies actually negotiate and pay. They are more than 3 times what the procedures actually cost the hospital to perform. For-profit hospitals set their chargemaster ratios even higher than nonprofit facilities, sometimes reaching ratios of 28-1, 28 times their actual cost. One detailed analysis found that 30 minutes of critical care from a California hospital could cost an uninsured patient 2,897% of what Medicare would have paid for the identical service delivered by the same people in the same room. That is not a typo. 29 times higher than Medicare rates for the exact same care. Think about what that means for ordinary Americans. If you walk into an emergency room without insurance coverage, or if you wind up at an out-of-network hospital through absolutely no fault of your own, during a medical crisis, you face chargemaster prices. These are prices designed as opening bids in a negotiation game that most patients do not even know they are playing until they get the bill. A comprehensive study of Dallas area hospitals found price variations exceeding 1,000% for identical procedures. Same surgery, same technique, same outcome. Wildly different prices depending on which hospital building you happen to enter. The patient has no way to know these prices in advance and usually no ability to choose during an emergency. Between 1996 and 2017, chargemaster markups increased on average by 155%. Hospitals discovered they could set essentially whatever prices they wanted because most patients never see the actual bill until after treatment is completed. And by then, what choice do you have? You already received the care. The charges are set. Your only option is to pay or face collections. The result is a system of surprise medical bills that devastate families who did everything right. You carefully chose an in-network hospital. You verified your coverage. An out-of-network anesthesiologist or radiologist you never chose and never met treats you during your procedure. Suddenly you owe thousands, sometimes tens of thousands. The chargemaster rates hit you at full force with no warning. Some states have passed laws against surprise billing in recent years. The federal government enacted protections called the No Surprises Act, starting in 2022. But enforcement is patchy at best, and loopholes abound. Hospitals and insurers fight endlessly over who should pay these disputed amounts, while patients get caught in the crossfire with their credit scores and financial futures hanging in the balance. And this is exactly how we end up where we are today. Drowning in medical debt despite having insurance. facing bankruptcy despite doing everything right. 41% of American adults carry some form of medical debt right now. That includes money owed to hospitals, balances sitting on credit cards borrowed for medical bills, informal loans from family members, and amounts sitting in collections destroying credit scores. The total medical debt reflected on credit reports exceeds $88 billion. Some researchers estimate the true total, including all forms of medical borrowing, approaches $220 billion. Approximately 30 million Americans borrowed money specifically to cover healthcare bills in 2024 alone. 30 million people in 1 year. 3 million individuals now owe more than $10,000 each in medical debt. Nearly 6% of all American adults owe over $1,000 in medical debt right now as you listen to this. And this debt does not discriminate based on whether you have insurance. 56% of insured Americans carry medical debt. Having coverage does not protect you when your annual deductible is $9,000 for an individual or $18,000 for a family. When you face those numbers, insurance feels more like catastrophic coverage than actual health protection. The average retired couple reaching age 65 now needs roughly $275,000, set aside just to cover medical expenses through the rest of their lives. $250,000, accumulated over an entire working career, can disappear into healthcare costs during retirement. That assumes nothing unusual happens. No serious cancer, no extended nursing home stay, just routine aging in America. 2/3 of all personal bankruptcies in America involve medical debt as a contributing factor. Researchers estimate that translates to over 530,000 families filing bankruptcy every year, driven at least partly by healthcare costs. Every single year, over 500,000 families. That is more than the entire population of Wyoming filing bankruptcy annually because of medical bills. 70% of Americans struggling with medical bills have had to cut their food expenses to avoid complete financial collapse. They literally choose between eating adequately and treating their chronic conditions, between groceries for their children and medication for their diabetes, between food on the table and chemotherapy that might save their lives. Ever noticed how healthcare costs just keep rising, no matter who promises to fix them during election season? Drop a comment below if you have watched your premiums climb every single year, regardless of which party controls Washington. Now let me explain why this situation is essentially permanent under current conditions. Why all the soaring rhetoric about healthcare reform never actually changes anything meaningful. Because the people profiting from this system have effectively purchased the people writing our laws. The healthcare industry spends more money on lobbying than any other sector of the American economy. Pharmaceutical companies, insurance companies, hospital associations, medical device manufacturers. They flood Washington with billions of dollars every election cycle. They hire former congresspeople as lobbyists. They fund think tanks that produce friendly research. They write the regulations that govern their own industries. Every serious attempt at cost control gets diluted before it passes. Every transparency requirement gets riddled with loopholes that render it meaningless. Every promising reform dies in committee or emerges so weakened by amendments that it changes nothing substantial. This is not conspiracy theory. This is documented fact. The campaign finance records are public. The lobbying disclosure forms are available. The revolving door between industry and government spins constantly. The healthcare system is not broken in the sense that it accidentally fails to serve patients. It is working exactly as its owners designed it to work. It transfers wealth from sick people to shareholders with remarkable efficiency. It extracts maximum payment for minimum care with sophisticated precision. It denies claims until patients give up in exhaustion. It marks up generic cancer drugs by 3,000% because there is nobody to stop them. It charges 28 times actual cost because patients have no alternatives during emergencies. And the people running these companies are rewarded handsomely for this wealth extraction. $26 million for the UnitedHealth executive, $23 million for Cigna leadership, a collective $159 million for 6 individuals. While American families ration insulin and skip cancer screenings they cannot afford, the mathematics of this system guarantee it will consume more of our national economy every year until something forces change. Healthcare spending grows at 5.8%. Economic output grows at 4.3%. That gap is relentless, and it compounds over time. It means your children will face harder choices than you do today. Your grandchildren will face harder choices still. Unless something fundamental changes in how we organize healthcare in America, these costs will eat the middle class alive. Not in some distant theoretical future. Now, today, this year, and every year that follows. The warning signs are everywhere if you choose to see them. Rural hospitals closing and leaving entire counties without emergency care. Young families avoiding doctors entirely because they fear the bill more than the illness. GoFundMe pages becoming a primary healthcare financing mechanism. People dying because they rationed insulin that costs $3 to manufacture, but $300 to purchase. And the industry responds with slick marketing campaigns, with television advertisements showing smiling patients and caring doctors, with corporate slogans about being on your side, with mission statements about improving health outcomes. While their algorithms deny your claims automatically and their executives cash 8-figure compensation packages, this is what we are up against as patients and citizens. Not bureaucratic incompetence, not accidental complexity, deliberate design, a system built from the ground up to maximize wealth extraction, wrapped carefully in the language of caring and healing. But here is what the people running this system fear most. They fear informed patients who understand how the game is rigged. They fear voters who see through the talking points and campaign promises. They fear workers who demand better coverage from their employers. They fear shareholders who question whether executive compensation serves any legitimate business purpose. The people profiting from healthcare dysfunction depend absolutely on your confusion. They count on complexity to hide their margins. They rely on despair to prevent organized change. They bet that you will be too overwhelmed to understand or too exhausted to fight back. Do not give them what they want. Understand the numbers. Share them with everyone you care about. Ask your employer tough questions about why they chose their insurance plan. Look up your local hospital's chargemaster prices online, because they are legally required to publish them now. Check your insurer's claim, denial rates before selecting coverage during open enrollment. Appeal every denied claim because the odds are actually in your favor. And the next time your premium increases for the 14th year in a row, remember exactly where that money actually goes. Not to nurses working double shifts, not to doctors drowning in paperwork, not to better care or new treatments or improved outcomes, to executives making 300 times what their employees earn, to middlemen marking up cancer drugs by 3,000%, to an industry that has spent decades perfecting the machinery of extraction. Healthcare in America is not expensive because medical care is inherently costly to provide. It is expensive because the system is deliberately designed to extract maximum wealth from sick people who have no meaningful alternative. Every layer of complexity creates another opportunity for profit-taking. Every denied claim pads somebody's bottom line. Every confused patient is a customer who will not negotiate effectively. Other countries spend half what we spend and achieve better outcomes across virtually every measure. They prove this system is not inevitable. It is not the only way healthcare can work. It is a choice made by people who profit enormously from your suffering and have every incentive to prevent change. Until we collectively make a different choice, the math is brutally clear. Healthcare costs will continue consuming more of everything you earn year after year. More families will face bankruptcy through no fault of their own. More people will skip medications they need to survive. More children will grow up watching their parents choose between their health and their financial security. And the executives running this machine will continue depositing checks larger than most people earn in a lifetime. They will attend conferences about innovation and patient-centered care. They will publish annual reports about their commitment to improving health outcomes. And they will keep right on extracting wealth from sick people because nothing in the current system stops them. This is the hidden truth about why nobody can afford healthcare anymore. Not because medicine costs too much to provide, because a system built to profit from illness will always generate more bills than cures. Subscribe now. And if you are watching on TV, tap your remote so you never get blindsided again.